1 in every 4 Brazilians will have a heart attack before the age of 50. And if you think that getting that annual checkup with the basic tests and that if everything comes back normal, you're safe, you're sorely mistaken. These tests are incomplete and often evaluated incorrectly. Just to stick with the cholesterol example, did you know that 75% of patients who have a heart attack have low or normal cholesterol? There's no point in reaching heaven and saying your test results were perfect. It'll be too late. In this video, I'm going to show you the really important tests and how to properly assess your cardiovascular risk, the ideal parameters, and what to do to avoid becoming part of this sad statistic. So go ahead and leave your like, your thumbs up on this video, share it with other people, and let me know, do you get an annual checkup? Which tests does your doctor order? Tell me in the comments below. Everyone who gets annual tests has only one concern. How's my cholesterol? If it's low, it's all good. You can keep living your wild life. You basically consider yourself immortal. But if it's high, that's not a problem either. After all, your doctor will prescribe a statin that you'll take for the rest of your life, and it'll force your cholesterol down. There you go, problem solved. This is as simple as it is wrong. 80% of our cholesterol is produced by our own body right there in the liver. Forcing it down can cause several problems like body aches, impotence, memory lapses, and even worse, in most cases, this doesn't improve your cardiovascular risk at all. So let's go over the main tests that are really important and how to evaluate them correctly. First, you need to measure your apolipoprotein B. Apolipoprotein B is a type of low-density lipoprotein. This one is small, it's dense, and it's potentially oxidizable. And if it's elevated, it increases your chance of forming an atheroma, which will lead to a future heart attack or future stroke. The ideal level of apolipoprotein B is for it to be below 80 milligrams per deciliter. Why does apolipoprotein B go up, Dr. Moacir? Actually, it's not the barbecue, it's not the steak, it's not the pork crackling. What actually causes apolipoprotein B levels to go up is a hyperproduction of this particle in the liver due to excess of fructose, refined sugars, meaning sugar itself, sweets, and flour-based foods, right? Hepatic steatosis, if you have fat in your liver, this speeds up the production of apolipoprotein B, elevated insulin. In other words, if you are pre-diabetic or diabetic, you tend to produce more apolipoprotein B. So taking statins is not what will reduce this cholesterol, which is indeed potentially atherogenic. But it's by changing your lifestyle, by stopping the consumption of these substances, which are real factories of apolipoprotein B. Another marker you should pay close attention to is lipoprotein A. It should preferably be below 14 milligrams per deciliter. It's a harder factor to control because it has a strong genetic component. So, if you genetically have high lipoprotein A, then you need to be even more careful with everything we've talked about. And also, check if it's not due to a drop in estrogen or progesterone. It's very common for women in menopause to have elevated lipoprotein A. So, pay close attention and talk to your gynecologist to see if hormone modulation might be necessary. Second test, homocysteine. Almost no one pays attention to this test. Elevated homocysteine is much more dangerous, but much more dangerous than high cholesterol. Homocysteine causes damage to the endothelium. It causes neuroinflammation. When the endothelium is damaged, the atheroma starts to form and the arteries begin to close, which will eventually cause a heart attack or a stroke. So that buildup of cholesterol that blocks our vessels happens because of the endothelium damage. Actually, the cholesterol is only going in there to do the repair. But if you damage the endothelium too much, the repair gets bigger and the arteries end up closing. And one of the biggest factors for endothelial damage is high homocysteine. It needs to be below 8, my friends. And why does homocysteine go up? Usually because you have a problem with methylation. We need to methylate methionine, which is an amino acid, and you need cofactors for that. Usually people with high homocysteine have low levels of these cofactors. Which cofactors are those? Vitamin B12 in the form of methylcobalamin. It's important that it's methylcobalamin and not cyanocobalamin because we need it for methylation. methylfolate deficiency and vitamin B6 deficiency, preferably in its active form, which is pyridoxal 5-phosphate. So, hear me out. High homocysteine is easy to fix. Methylcobalamin, methylfolate, and pyridoxal 5-phosphate. These are natural substances, they're vitamins. You can get them made at any compounding pharmacy, okay? I left the dosages in my supplement list. There's a supplement there called Superfolate. You'll see all the exact doses, so you can take it in case your homocysteine is above 8. Keep in mind, this is a far greater risk factor than cholesterol. Third, inflammatory markers. It's the subclinical inflammation that will oxidize the apolipoprotein B. Remember, we discussed it first, the small, dense cholesterol. If it doesn't undergo inflammation, if it doesn't undergo oxidation, there's no problem at all. The problem is the subclinical inflammation. If you are inflamed, this cholesterol will oxidize and will cause problems. How do you assess if you are inflamed? We have some classic tests. There's the high sensitivity C-reactive protein test. Your level should be under 0.5. Higher levels of C-reactive protein mean increased cardiovascular risk. It means that you are very inflamed. Ferritin is a marker and should be under 150. Many think it's only for measuring iron, but that's not true. High ferritin means liver damage. It means high inflammation. Fibrinogen, thrombosis, and endothelial aging are measured through fibrinogen. It needs to be below 200 milligrams per deciliter. Two other markers I like for assessing this type of inflammation, though rarely requested, are interleukin-6 and inflammatory cytokine. It needs to be below 1 picogram per milliliter, and tumor necrosis factor alpha, which needs to be below 2 picograms per milliliter, right? Tumor necrosis factor alpha is also in Nabayuans as TNF-alpha. So these inflammatory cytokines, if they are elevated, it means your body is inflamed. So Dr. Moacir, I did all the tests and my levels are all elevated. My body is inflamed. Now you need to reduce that inflammation, right? The biggest causes of inflammation are alcohol. If you are abusing alcohol, it's time to give your liver a break. Processed food, industrial food, soda, all that junk you always hear me talk about if you follow me. You're probably even more tired of it than I am. And also, if you eat a lot of wheat flour, a lot of gluten, which is highly inflammatory, it promotes inflammation in our intestines. And if you consume a lot of dairy products, casein, which is a protein found in milk, is a large protein. It's an inflammatory protein. It may also be the case of reducing dairy products to lower this inflammation if your markers are elevated. And finally, I want to mention a test here that's important and that a lot of people neglect, the basal insulin levels. The higher your insulin, the closer you are to developing diabetes. The ideal insulin level, my friends, is below 5, okay? Below 10 is tolerable, but the real ideal is below 5, okay? I know your test says 3 to 23 is normal, but that's not true. The real ideal is below 5. High insulin means insulin resistance and metabolic syndrome. It means you're heading towards diabetes, and nothing throws your body off balance. Nothing disrupts your metabolism more than high insulin, which is caused by too much sugar, too much fructose, too much flour. Do you understand? A simple change in your diet will improve your insulin levels, will reduce interleukin-6, will reduce tumor necrosis factor alpha, will improve fibrinogen, will lower your ferritin, your high sensitivity C-reactive protein. This will already lower your body's inflammation. And your apolipoprotein B levels, which were elevated, will also come down. And even if it doesn't go down that much, it will oxidize less because your inflammation will be more controlled. So do you see? It's more than just measuring total cholesterol. Any artificial intelligence can say, oh, it's high, take statins, and that's it. That's not it. Biochemistry is far more complex. You need to combine the tests, evaluate them correctly, and provide the right treatment. It's not only about medication, and I'm not against it. In many cases, it's necessary, but in most cases, you just need to evaluate the test correctly, do a dietary realignment for this patient, and that will help them improve naturally and not become part of the statistic of 1 in 4 Brazilians having a heart attack before the age of 50. Friends, my website is www.drmoaciraltogether.com.br. Having trouble typing it, you can't find it, just type Moacir Rosa on Google and you'll see it. On my website, as I mentioned, all the supplements I use and recommend are there. My courses are there, and my other social media as well. Don't forget to visit my website. And if you're not subscribed to this channel yet, it doesn't cost anything, my friends. It's free. Click subscribe and don't forget to hit the bell, then select all. I hope you enjoyed this video and found it useful. And tell me in the comments, does your doctor order these tests that I showed you here? Do they evaluate them properly? Leave your comment below. A warm hug, my friends. See you in the next video.